Here's Janice Sumpton from the Canadian Pain Coalition. Nice to see you again. You were on our couch about a year ago, and it's a pleasure to have you back.
Thank you.
And you're here, you have a cane yourself. Why don't you give us a bit of background on yourself?
Sure. I myself have been living with chronic pain since 1998. First started with nerve pain in my back. That didn't go away. And then developed fibromyalgia, which took 7 years to diagnose. So lots of different physicians, lots of different tests. Lots of frustration in that, and it's a fairly typical course in terms of needing quite a few different medical opinions to finally diagnose it.
Now, you went and you saw treatment, and you obviously had to go through many tests to find out, what the cause was of the pain. But often enough, so many people don't actually follow through with treatment or get tests done to really get to the heart of the matter and where is the pain coming from. Why do you think that is?
That's a really good question. And people have to be their own advocate to first seek help and then to carry through on whatever the management is or to the different options that there may be. And pain all the time, and you're not sleeping well, and it takes a lot just to kind of get through the day and maybe even get dressed and eat a meal, you're exhausted. So to get up and get out to follow through on some of those things, I think is just really, really difficult.
Why wouldn't people follow through? And you must have heard some stories. Why don't people follow through?
It's a really good question, and I see it. I work in the hospital, and I see it when people don't show up for their specialist appointments. And I don't have any really good answer for that other than I think lives get busy. If they have young families or they're trying to hold down a job, maybe they can't get away from their job to go to the treatment.
I think, there's a whole other side of things. It could also be, the mental side of what pain can do to somebody. I know myself, we talked earlier in the show about having Crohn's disease, and it can be a painful disease to have. Yes. And before I was diagnosed, I avoided going to the doctor for quite a while. I knew there was something wrong, but I avoided it because I knew there was something wrong. And so I think, maybe that kind of ties into the avoiding factor.
I agree, because you don't want to think about it all the time. You don't want it to override everything you're doing in your life. So you do try and shove it aside.
Let's talk about the event. Wednesday night, this Wednesday. It's November the 10th, by the way. Tomorrow night, 7 till 9 o'clock down at the Lamplighter, the Best Western Lamplighter. Tell us what's going on.
We're having a free seminar session that patients and family members, healthcare professionals can go online and register. And Dr. Stern is a physician who is going to be talking about some of the myths around pain, the truths, how to talk to your health professionals to seek help that you need, whether it's talking to your doctor, your nurse, your pharmacist, your physiotherapist. And along with Dr. Stern, giving the medical side and his perspective, there's also going to be a patient speaking about their experience with living with pain. So the event itself is going to be very informative. As well, there's going to be some nonprofit organizations setting up booths outside at the beginning before the event starts. The Canadian Pain Coalition is going to have a booth there. For those not familiar with the Canadian Pain Coalition, it is the voice of Canadians in pain, and we try to get information out to Canadians and put them in touch with different pain clinics or different resources that can help them manage their pain better. So there'll be a lot of information that people can pick up, take home, and read, as well as attending the Dr. Stern and the patient.
That's great.
Well, and for more information and for more resources, people can head to the website www.canadianpaincoalition.ca as well for more info.
Do you hurt? Are you in pain right now?
Yes, I am.
You are?
Yes. Every day, everywhere.
Yeah.
It's difficult to get around. I use the cane for balance.
Yeah.
And endurance, because part of that, my balance is poor, and if I fall, then that's acute pain on top of chronic pain.
Well, listen, Janice, thank you so much for being so open with us
Thank
and for
you.
getting the word out. We greatly appreciate it, okay?
Thanks very much for having me.